Please be seated. Colleagues, thanks very much. We are now starting on page 30 of the schedule, and we'll be looking at the appropriations to the Minister for Health and Wellness. And we'll start with HES 1, Policy Advice and Ministerial Services to the Minister for Health and Wellness in the amount of $8,161,762 for 2022 and $8,138,603 for 2023. Are there any questions? Okay. With that said, I put it to the vote. All those in favor of HES 1, Policy Advice and Ministerial Services to the Minister for Health and Wellness in the amount of $8,161,762 for 2022 and $8,138,603 for 2023, please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to HES 2, Health Regulatory Services in the amount of $2,460,814 for 2022 and $2,487,417 for 2023. Are there any questions? Honorable Deputy Leader of the Opposition.
Thank you, Mr. Chairman. Through you to the Honorable Minister, just again, looking at this appropriation, we had 12-month forecast of 250 in 2021, and we're forecasting number of certificates issued 45 to 75 for 22 and 23. Inspections down from, well, between 50 and 75 from 70. But then we've seen an increase in the appropriation from 1.7 to 2.4, almost 2.5 in 2023. Can the Honorable Minister provide some insight for this?
Honorable Minister for Health.
Mr. Chair, through you, that is to bring that amount up to the SBS target. HES 2? Mr. Chair, through you, can I ask the Honourable my colleague to repeat his question so I can make sure I answer it directly?
Honorable Deputy Leader of the Opposition. Thank you.
Thank you, Mr. Chairman. Mr. Chairman, I'm just questioning. We had a figure of $1,734,501 for 2021 12-month forecast. For 2022, we have $2,460,814, 2023, $2,487,417. However, it seems that this number of certificates issued is down to 45 to 75 from 250. Most things are around the same thing. We do have an item number of papers, reports, speeches, statements, responses to questions, and replies to correspondence. Went from 8 to 1,100 to 1,600. So I'm just trying to get some understanding of where the almost $1 million in increase on this appropriation comes from.
Mr. Chair, through you, may I request the Director to come and speak directly to these figures, please? Mr. Chair, I'll call on the director to have them address these numbers, with your permission, please.
Which one you prefer? Swear or affirm?
I swear by Almighty God that the evidence I shall give to this honorable Parliament shall be the truth, the whole truth, and nothing but the truth.
Thank you. Thank you very much, Director. Before answering the first question, can you state your name and title for the record, please? Thank you very much.
Thank you, Mr. Chair. Good afternoon. My name is Melissa Webb, and I am the financial accountant for the Health Regulatory Services. Through you, Mr. Chair, the budget numbers that we're talking about as an increase from 2021, 1.7 million to 2.3, right here, sorry, 2.460814, and 2022 and 2023, 2.487417 is an increase of personnel costs. The number of certificates issued and on-site inspections, publications, all of these quantity measures are actually taken out of the 10 outputs that we have per department. So these 5 line items that speak to that, those numbers are actually taken from HRB 9 to HRB 18, which gives a more comprehensive breakdown of each output, each certificate issued per output. Mr. Chair, through you, in addition, I'd like to draw you, as I was speaking before about the outputs, HRB 9 to HRB 18. So if you look at HRB 9, you'll also see the certificates issued in there. Number of certificates issued was actually budgeted 200 to 275 for 2022, 225 to 300 for 2023. On the budget statement. Page 37.
Through you, Mr. Chairman, so I think I understand what the member is saying, that this appropriation covers personnel cost increases throughout HES 9 through HES 18?
Correct. HRB. HRB, through you, Mr. Chair, HRB 9 to HRB 18.
Okay.
Is there another question? If not, I'll take the,
Nothing.
if not, I'll take the vote. All those in favor of HES2, Health Regulatory Services? Sorry, colleagues. Went on the wrong passage. All those in favor of HES2, Health Regulatory Services, in the amount of $2,460,814 in 2022, and $2,487,000. $417 in 2023. Guys, let's bear with me. Sorry, all those in favor of HES2, Health Regulatory? I have to do the right way, sorry, guys. All those in favor of HES2, Health Regulatory Services, in the amount of $2,460,000. Sorry. Yeah, HES2, colleagues, sorry. All those in favor of HES2, Health Regulatory Services, in the amount of $2,460,814 in 2022, and $2,487,470 in 2023. Please say aye. Aye. Against, no. Sorry, HES7. Guys, come. HES7, collection. Yeah, I'll take a 5-minute break. Sorry, guys. Apologies. Yeah, 9, start at 9. Please be seated. I would ask all members in the chamber not to send me any more texts or any pictures. Thank you. Moving on to HES 7, collection, recycling, and disposal of waste in the amount of $7,241,094 in 2022 and $7,460,361 in 2023. Are there any questions? Honorable Deputy Leader of the Opposition.
This is HES 7?
That is correct. Sorry, we did, yeah.
I don't, yeah. you
Yeah,
did-
HES 7, yeah.
Yeah. Thank you, Mr. Chairman. Through you to the Honorable Minister. We do notice about $1 million increase here in this appropriation as well. I also notice on the timelines that we see a twice per a week as per current residential collection schedule. I don't think we're currently collecting twice per week. Is that a proposal, and is that contributing to the increase in the appropriation?
Mr. Chair, through you.
Yes, Honorable Minister.
To answer the question, the twice weekly, once a week is for regular household collections, and the other one is for recyclables. We've increased the bin capacity for this collection, so those will include resources and additional staffing to make that a reality.
Honorable Deputy Leader of the Opposition.
Thank you, Mr. Chairman. I thank the Minister for that response. So we are going to a twice per week residential collection.
I've been reliably informed that it would include regular recyclable of residential and the recyclable bins that are strategically placed, and regular collection of garbage. Household. The
So-
two will be over twice a week. So you'll still be once a week for regular household trash, and the other would be for recyclable items. However, I can ask permission for the director to expand on that response.
Sorry, would you prefer swear or affirm?
I swear by Almighty God that the evidence I shall give this honorable parliament shall be the truth, the whole truth, not but the truth.
Thank you. Thank you very much, Mr. Sims. Before responding to the Honorable Deputy Leader of the Opposition, can you state your full name and title for the record, please, before your response? Thank you.
Yes, Mr. Chairman. My name is Richard Sims. I'm the Director for the Department of Environmental Health. Through you, Mr. Chairman, to the member, as the Minister just stated, what we're hoping to do is increase the provision in place to have recyclables, curbside recyclables collected, and to do that, we will be providing the bins to the various residents, in addition to our regular collection. And further to your question, I think it was alluding to the landfill operations with the increase of the extra $1 million. That is to cover, obviously, the landfill operation, which has been increasing in terms of rental of equipment and additional things to keep the landfill going. We've seen an increase in waste coming into the landfill, and we have to have additional resources to deal with those matters.
Any other questions? Thank you. I put to the vote all those in favor of HES 7, collection, recycling, and disposal of waste, in the amount of $7,241,094 in 2022 and $7,460,361 in 2023. Please say aye.
Aye.
Against, no. The ayes have it. Colleagues, we move on to HES 8, Public Health Services, $3,120,121 in 2022 and $3,155,903 in 2023. Are there any questions?
Mr. Chair, through you, I'm not 100% sure if this is where I would ask the question, but while we had the director in the seat and after being sworn in, I did see the printing of leaflets on rodent control. I just wanted to, my question to the Honorable Minister or to the directors, how many people do we now have doing rodent control across the Grand Cayman?
Honorable Minister for Health or Director?
To you, Mr. Chairman, to the member, currently, as it stands, I have one officer covering in Thailand, but we've recently advertised, and it's just a matter of shortlisting now and interviews for one position in Cayman Brac and 3 others in Grand Cayman. So hopefully, I should have those vacancies filled within the first quarter of 2022.
Are there any other questions? Now I put to the vote. All those in favor of HES 8, Public Health Services, $3,120,121 in 2022 and $3,155,903 in 2023. All in favor, please say aye.
Aye.
Against, no. The ayes have it. HES 9, Environmental Health Monitoring Services, $754,086 in 2022 and $764,736 in 2023. Are there any questions? Sorry, seeing that there are no questions, I put it to the vote. All those in favor of HES 9, Environmental Health Monitoring Services, in the amount of $754,086 in 2022 and $764,736 in 2023, please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to HES 10, Emergency Response Services, $190,199 in 2022, and $171,417 in 2023. Are there any questions? Okay, seeing that there are no questions, I put it to the vote. All those in favor of HES 10, Emergency Response Services, $190,199 in 2022, and $171,417 in 2023. Please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to HES 11, Mosquito Control Services. The amounts are for 2022, $11,328,997, and for 2023, $11,380,498. Are there any questions? Okay, seeing that there are no questions, I put it to the vote. All those in favor of HES 11, Mosquito Control Services, in the amount of $11,328,997 for 2022, and $11,380,498 for 2023. Please say aye.
Aye.
Against, no. The ayes have it. HES 18, Counseling and Support Services. The amounts are for 2022, $4,750,083, and for 2023, $4,782,681. Are there any questions? Honorable Deputy Leader of the Opposition.
Yeah, Mr. Chairman, through you, the counseling services currently being offered, is there a collaboration between those services being offered within Her Majesty's prison and those outside of the prison? The reason I ask the question is because I have seen just recently a large, what seems like most people that come out of prison end up right back on the street within a matter of days, back to their old habits. And I'm just wondering if I know that the prison have rehabilitation programs within the prison. I just wonder if there's a continuation of those services provided to the inmate when they are released.
Honorable Minister for Health.
Mr. Chair, through you, I would request your indulgence in having the director of that department to expand.
No problem.
Thank you.
I swear by Almighty God that the evidence I shall give to this honorable Parliament should be the truth, the whole truth, and nothing but the truth. Thank you very much. You're very welcome, sir.
Thank you very much, Director. Before responding to the Honorable Deputy Leader of the Opposition, can you state your name and title for the record, please? Thank you.
Thank you, Mr. Chairman. My name is Judith Seymour, and I'm the Director of the Department of Counseling Services. Through you, Mr. Chairman, services provided in the prison are actually done in collaboration with the Department of Community Rehabilitation and the prison. A decision was taken some years ago by the former prison director that they wanted to have their services done internally, and now I believe the Department of Community Rehabilitation provides through care services for persons who enter prison and then transition into the community. Some of those persons are referred to our programs, and if they are provided with the services.
Okay, any other questions? Now I'll put it to the vote. All those in favor of HES 18, Counseling and Support Services, in the amount of $4,750,083 in 2022, and $4,782,000 for $4,782,681 in 2023. Please say aye.
Aye.
Against, no. The ayes have it. Colleagues, we're moving on to HES 19, Policy Advice and Awareness Programs, $224,938 in 2022, and $224,730 in 2023. Are there any questions? Okay, seeing that there are no questions, I'll put it to the vote. All those in favor of HES 19, Policy Advice and Awareness Programs, $224,938 in 2022, and $224,730 in 2023. Please say aye.
Aye.
All against, no. The ayes have it. Colleagues, we're moving on to HEA 2, Medical Care for Indigents. The amount is $12 million for 2022 and $12 million for 2023. Are there any questions? Honorable Member for Red Bay, Mr. Alden McLaughlin.
Thank you, Mr. Chairman. Mr. Chairman, I've been sitting here looking at this and puzzling. I'm sure there must be some reason, but if we forecast that this year will cost us $20,971,006, on what basis do we forecast that next year will only be 12 million, and the year following only 12 million?
Honorable Minister for Health.
Or Mr. Chairman, you know I've been around this block a while. Is this just a fudge?
Fudge is a very strong word, Mr. Chairman. The truth of the fact is, you know, it's a very difficult number similar to NGS 55, because the HEA 2 is the one that's actually done at the HSA, and NGS 55 is the non-HSA care. It's always a number that's very difficult to budget for each year. So I do understand where you're coming from, so.
But this is, I mean, past performance is the clearest indication of what the future is likely to be. I mean, this is, yeah, I don't know, fudge is probably the wrong word. Things need something a bit stronger, almost misrepresentation of what the forecast is likely to be.
Well, actually, I will leave it to the, well, actually, no, to some extent, because one of the things that can be argued is that as our people become more healthy, or become more health conscious, because remember, bear in mind, 2021 is a unique year with COVID and everything else. So as the ministry put through more programs for wellness, there's a very strong possibility that our people may be healthier. And I'm sure you would want our people to be more healthier too.
Excellent try, Mr. Chairman. But that, sir, is what will eat that small little projected surplus you have for 2023. That's it right there.
If there's any consolation, Honorable Member for Red Bay, the 12 million versus the 20-odd million forecast was the same number from the last budget under your administration.
I told you I've been around this block a while.
I know, and we learn from the best.
All right. Well, didn't learn that from me, but
Actually, no, learn from more than you, several of you.
you are the super qualified accountant, so it'll be on your head, not mine this time.
Yeah, but I'm sure you'll approve it if it goes above, because I'm sure you want us to look after our people. Thank you very much. Any other questions?
Mr. Chairman, not a question, but just a minor statement. I almost feel like a bit of a deja vu, because I recall going through that exact same line of and position with the last budget in this exact same output. So it seems to be a common practice, not only for the last administration, but going forward, as per the difficulties for projections. So he's well aware of the circumstances, and it's nothing far from what was happening before.
We went around the block with him too, that's fine. I take it, I was in your position last time when I had the same questions too, so I completely understand. But you were very optimistic in terms of people taking care of themselves also, so I share your optimism. All those in favor of HEA 2, Medical Care for Indigents, 12 million for 2022 and 12 million for 2023, please say aye.
Aye.
Against, no?
No.
The ayes have it. Mr. McLaughlin, you really won't vote even $1 to help our people? Okay. HEA 6, medical services in Cayman, Black and Little Cayman, $3,783,158 in 2022, and $3,783,158 in 2023. Are there any questions? Thank you very much. Seeing that there are no questions, I put it to the vote. All those in favor of HEA 6, medical services in Cayman, Black and Little Cayman, $3,783,158 in 2022, and $3,783,158 in 2023. Please say aye.
Aye.
Those against, no. The ayes have it. Colleagues, moving on to HEA 10, ambulance services. The amounts for 2022 are $3,638,537 for 2022, and for 2023, $3,395,237. Are there any questions? Honorable Deputy Leader of the Opposition.
Thank you, Mr. Chairman. Once again, to the Honorable Minister, there's just over $1 million increase from 2021 to 2022. If the Minister could explain that for us.
Honorable Minister.
Mr. Chair, through you, the 2022 budgetary allocation is for, we know that we have seen the increase in demand of the services, provisions of a 24-hour-a-day pre-hospital emergency care, non-emergency transport for residents and visitors to our islands, and this will also include, as I stated, the non-emergency transport services. Now, we look at the EMS service that consists of 3 teams, and 1 team is based in West Bay to cover the entire West Bay Road corridor up to the Ritz-Carlton. The second team is based in Georgetown, from the Ritz-Carlton that goes onto West Bay Road, and then to Belford Estates in Bodden Town. The third team is based in Northtown and covers everything east of Belford Estates. So when you look at expanding for provisions are made for an additional ambulance service for the eastern districts, those discussions are still ongoing in identifying a place for that. I know my honorable colleagues are definitely looking further east, but that is also in this appropriation. Also, the increase is to cover the cost of that additional EMS team to be stationed. Right now, it was posed for Bodden Town, which adds an additional and well-needed service for the eastern districts. Now, whether that is the final resting place, that's to be, but what we can establish here that there's definitely more coverage that is required into the eastern districts, and the highlighted cost in the 2022 represent the cost of that ambulance and training for the team, in addition to the cost of the non-emergency transport vehicle as well.
Any other questions? Thank you, Mr. McLaughlin. With that, I'll take the vote. All those in favor of HEA 10, ambulance services, in the amount of $3,638,537 for 2022, and $3,395,337 for 2023, please say aye.
Aye.
Against, no. The ayes have it. HEA 11, services at district health clinics. The amounts for 2022, $2,489,947, and for 2023, $2,489,947. Are there any questions? Okay, seeing that there are no questions, I put it to the vote. All those in favor of HEA 11, services at district health clinics, in the amount of $2,489,947 for 2022, and $2,489,947 for 2023. Please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to HEA 12, Mental Health Services. The amounts for 2022 is $4,395,204, and for 2023, $4,245,204. Are there any questions? Honorable Alden McLaughlin.
Thank you, Mr. Chairman. Mr. Chairman, looking at the description and the location in those two sections, these numbers here, which you just recited, do not appear to cover the cost of the operation of the long-term residential facility currently under construction in East End. Where is there provision for that in the budget?
Honorable Minister for Health.
Mr. Chair, through you, because that would be in another line item that will fall directly under the ministry, not under HSA.
So it'll come later then?
Yes, sir.
Thank you.
You're welcome.
Thank you very much for that. I'll take the vote. All those in favor of HEA 12, Mental Health Services, $4,395,204 in 2022, and $4,245,204 in 2023. Please say aye.
Aye.
Against, no. The ayes have it. HEA 16, Geriatric Services, $4,376,497 in 2022, and $4,376,497 in 2023. Are there any questions? Honorable Member for Red Bay, Mr. McLaughlin.
Thank you, Mr. Chairman. Mr. Chairman, the amount forecast to be spent this calendar year is only just over $615,000, and it's leapt up to $4,376,497 for next 2 ensuing years. I'm sure there's an explanation for it. Maybe this is part of the transformation that the Minister for Social Development spoke about, and it may be over there, but might be some crossover there, but if I could have some explanation for the significant increase.
Honorable Minister for Health.
Mr. Chair, through you. Patients are assigned to this particular allocation for a single encounter and then referred, as you rightly stated, by the Needs Assessment Unit for continued coverage. There are some patients who are unwilling to access NAU services, and others are not indigent but require financial assistance for medical care for a period or based on an episodic. These services are ongoing well and with little to no challenges. It's adequately managed by the Patient Financial Services and the team in conjunction with the Patient Experience Manager. And through the need for coverage has been steady since the incline of 2019 and a drastic increase from 2020. So with what we're planning on doing with my honorable colleague responsible for that ministry, we will be working in collaboration with my honorable colleague, Minister Ebanks.
So for
Apologies, sorry, honorable members, it appears there seems to be an error in that presentation. The 21 number, if you were to actually look.
21.
Sorry, in the purchase agreements, and I do apologize for that, the actual 2021 forecast for the 12 months is actually the same for 2022 and 2023. So there's actually a typo, Mr. McLaughlin, and I do apologize for that. But the amount has remained flat between 2021, 2022, and 2023.
that's why we're over here.
That's right. Very good opposition. So I guess the question, yeah, and I do apologize for that. That's on my finance team. So,
Yes, Mr. Chairman, because I was going to give the minister a little trouble if that was her only answer, but I see now, we're good.
thank you very much, sir. That one is on us. With that said, let's put it to the vote. All those in favor of HEA 16, geriatric services, in the amount of $4,376,497 in 2022 and $4,376,497 in 2023, please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to HEA 17, medical care beyond insurance coverage / uninsured, $4,034,418 in 2022 and $4,034,418 in 2023. Are there any questions?
We're good with that, Mr. Chairman.
Thank you very much. Colleagues, I'll put it to the vote. All those in favor of HEA 17, medical care beyond insurance coverage / uninsured, in the amount of $4,034,418 in 2022 and $4,034,418 in 2023, please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to HEA 18, school health services. The amount for 2022 is $1,918,778, and for 2023 is $2,018,778. Are there any questions? If not, I'll put it to the vote. All those in favor of HEA 18, school health services, in the amount of $1,918,778 for 2022 and $2,018,778 for 2023, please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to HEA 19, medical care for chronic ailments. The amount for 2022 is $1,359,255, and for 2023, $1,359,255. Are there any questions? Honorable Deputy Leader of the Opposition.
Thank you, Mr. Chairman. Through you to the Honorable Minister. There's a large increase here again, almost doubling it. I do see where they are projecting quite a substantial range of patients between 40 to 200 versus 60 forecasted for 2021. Is there a particular reason we're seeing an increase in, or expecting such a wide increase in patient services?
Honorable Minister for Health.
Mr. Chair, through you. The need of this coverage has been steadily on an incline and attributed to Cayman's aging population, with the need for the coverage doubling from 2020. We have seen an increase. Hope that satisfies your query.
Honorable Deputy Leader of the Opposition.
Thank you, Mr. Chairman. I mean, I see that they're projecting a huge increase. I just wondered whether there was any particular reason or any insight as to why such a large increase. Have we added additional services, or have we had that much of an increase in things such as or the non-communicable diseases, cancer, hypertension, diabetes, etc.?
Mr. Chair, through you, we've seen just an increase in demand for services, and with chronic medical, and who initially presents themselves pretty much at any time at HSA without insurance and underinsured. So this is enabled for us to keep up with the demand being required and being asked of the service that is provided.
Mr. Chairman, it seems to be another error in the purchases agreement in respect to the numbers. If you go to page 597, you see that the figure for 2021 doesn't correlate with the figure for 2021 on page 276 of the planning and estimates.
All right, thanks much. We take the vote on HEA 19, medical care for chronic ailments. All those in favor of HEA 19, medical care for chronic ailments, $1,359,255 in 2022, and $1,359,255 in 2023. Please say aye.
Aye.
Against, no. The ayes have it. Colleagues, we're reaching to page 31. I will start with HEA 20, Public Health Programs, Investigation and Treatments, in the amount of $2,409,835 for 2022, and $2,409,835 for 2023. Are there any questions? Honorable Alden McLaughlin.
Thank you, Mr. Chairman. Mr. Chairman, I've been through this section of output groups purchased by the Minister of Health and Wellness a few times now. And what I find most curious is that there is no reference anywhere herein that I can find to the work and the resources allocated to managing, treating COVID-19. I'm not sure where that is accounted for in the budget document. I see reference here, I thought it would have been here, but this speaks about medical examinations and tests and so forth in relation to HIV, AIDS, tuberculosis, malaria, and other communicable diseases. But given the amount of resources we have devoted over the last almost 2 years now to COVID-19, I would have thought there would have been some reference in the budget document to those costs.
Honorable Minister for Health.
Mr. Chair, I'll like your permission for the CEO to come up and respond to that, please.
We're gonna get in trouble for that. I just not do it what you do, but what you not suggesting to your minister, to the clerk. She do that. It looks rather odd for the chairman to keep getting up and doing it.
I swear by the Almighty God that the evidence I shall give to this honorable Parliament shall be the truth, the whole truth, and nothing but the truth.
Thank you very much.
Thanks.
Madam CEO, welcome. Before answering the honorable member for Red Bay's question, can you just state your name and title for the record, please? Thank you.
Lizette Yearwood, CEO of the Health Services Authority. Mr. Chairman, through you, the way that the COVID expenses has been managed right from the beginning of the pandemic is a direct reimbursement through the Ministry of Finance. It has not been a specific output under the Ministry of Health and Wellness.
Thank you. Then my next question, Mr. Chairman, is for you. Does that appear in the appropriations to you?
Sorry, Mr. Chair. Sorry, Mr. McLaughlin. I was distracted. Speak to the first. I didn't hear the answer.
I'll let the chief answer. The minister didn't hear your response, ma'am.
Mr. Chairman, through you, the reimbursement for the COVID expenses is through the Ministry of Finance, and it is not represented as an output under the Ministry of Health and Wellness.
Sorry, just confirming FS. Basically, what we did for 2022 and 2023 budget, just for this year, we pretty much add a line item which is 10 million plus, just related to COVID, to cover many things with COVID. We don't have an exact number in terms of what it would be, but there's 10 plus million budgeted for COVID-related different activities. So it may, if needs be, cover some of that cost.
So then, Mr. Chairman, thank you for that. So if the Ministry of Health and Wellness or the HSA ordered supplies or procured anything, medicines or whatever the case may be, to deal with the COVID matter, the practice was or is that they would expend the necessary money and it's reimbursed through the Ministry of Finance?
The current system now set up is that way correct in terms of OE 140, which was the vote that was basically set up. This is what we're currently using right now. So every COVID-related expenses, because it was never a line item, a budget or a department or anything, we just have that one cost center that track all the COVID-related expenses. So yeah.
So is that what created the confusion with the ordering of test kits by Blue Water Medical and Crown agents?
No, that's a whole different thing altogether.
Could we get an explanation as to what transpired there and where the matter is now?
Well, I think that's one of the parliamentary questions they have filed, so we deal with it in the,
No, Mr. Chairman, I may never get to the parliamentary questions. We're in Finance Committee now, and this is, I believe, the most appropriate place of all for that matter to be properly interrogated.
sorry, what was your question, sorry?
Mr. Chairman, you did respond to the first part of my question. You said that the current accounting arrangements were not the reason for what I called, this may be the wrong word, confusion with respect to what I think, or what seems to be the double ordering of LFT kits, one set ordered from Blue Water by the Ministry of Health and Wellness and the other by the Ministry of Finance from Crown agents. And I'm trying to get an understanding of what transpired there and ultimately what the current situation is and whether government is out of pocket as a result.
Actually, well, to answer the question, first of all, the Ministry of Finance never ordered any LFT. Those are actually ordered by the Ministry of Education, which the Finance Ministry paid for order OE 140, and then the Ministry of Health also had a separate order that was paid for out of their own ministry budget.
Thank you for that clarification. If we can take this a little further, what we've seen in the media indicated that the kits ordered by Blue Water were, I don't want to use the word cheaper, were less costly than those procured through Crown agents. And what I'm trying to understand is what created that situation and whether or not Blue Water has now been made whole, whether the government is in receipt of both sets of kits, that is both orders, and if not, what the current situation is.
What I can say is, one, it is, first of all, you don't believe everything you read in the media, I'll say that to you. Secondly, there's two separate transactions altogether. What I will admit is that maybe there must have been some crossing communication lines, but they were dealt with separately. And what we have done is that we have actually asked the Auditor General to take a look at the process to directly see what had basically happened to have created, but in essence, there were two separate transactions, one by the Ministry of Health and one by the Ministry of Education. So they are two separate things altogether.
Right, but clearly something went wrong because I don't believe everything I read in the paper at all. which, Mr. Chairman, with respect, is why I'm asking you, who I think would have a clear understanding of what actually transpired. So how did we wind up, I shouldn't say we, how did you wind up with a situation where the Blue Water order was canceled and the result was court proceedings, which I gather now have been withdrawn as the matter has been settled?
Well, I'm sorry, I am not aware if the matter has been withdrawn or it was still before the court. That I have not been updated by the Attorney General in that regard. But what I can say was always the intention of the government to order 2 million LFT kits. I know 1 million was done by the Ministry of Health and 1 million was done by the Ministry of Education. That much I can say. So it was always the intention to order 2 million LFT kits.
Mr. Chairman, if I may, by no means am I trying to...
Mr. Chairman, with respect, the minister is not responsible for either of these ministries. If he wants to comment, that's fine. I'm trying to ascertain
Mr.
through you,
Chairman,
sir.
I'm still an elected member of this House who is allowed to ask questions. Maybe it's not convention to do so, but I still have the privilege to do so in this committee. So if you recognize him before me, then I'll accept that, Mr. Chairman. But I do have a right to ask and speak just as much as you.
Mr. Chairman, I'd never tried to interfere with his right to ask. I'm trying to stop him from interfering with my right to ask. Mr. Chairman, what I'm trying to understand, I've gotten a little further down the road. So the intention always was to order 2 million, but the initial order placed by the Ministry of Education was for 1 million to Blue Water. But my understanding was that the Blue Water order was placed first.
Well, you see, this is where I guess the confusion came in because health did one order, education did one order, and pretty much everybody was basically trying to pull from the same, I guess, pool to some extent. But from the Ministry of Finance standpoint, we recognize the Ministry of Education order at that point over the Ministry of Health.
There is a procurement process for orders of this size, right, conducted by the ministry?
The Ministry of Education order was actually done via a cabinet paper. And at that point, cabinet had agreed pretty much to do a single source in the interest of time to actually get the 1 million in so that the kids at least could be tested from the LFT here for the Ministry of Education.
But help me to understand this. In my experience, the determination of whether or not it is an appropriate order for a single source is one that isn't determined by cabinet. It's either determined by the procurement committee itself or by the ministry's procurement committee. How does cabinet get into the role of deciding whether something is appropriate for single source or not?
Because at that point, it was actually deemed to be an exceptional purchase, which at that point, it was not subject to the procurement law. So Section 3 of the procurement law actually states out the exemption. So from that standpoint, we had a situation where, and this is the reason why we asked for it to be reviewed, where we had, within the procurement law as it stands, up to 100,000 can be approved by the chief officer. Up from 100,000 to 250,000 is done at a ministerial procurement committee. In this situation, this was actually above the ministerial committee limit, but at the same time, it did not go to the public procurement committee. So it kind of left a limbo area. Thus the reason why that decision was made in terms of using a cabinet paper and have it being done that way. Thus the reason why we have asked both the Attorney General and the Office of Auditor General to actually take a look at both processes to see exactly what it is that we need to do to make sure when something is outside of the public procurement process, but also above the limit of the actual ministry, how then do we deal with something like that? Because one of the things that we found out is like during COVID, for example, many of the transactions that were made actually was not even a procurement process, and it was also outside that limit. So why we never, during that time, actually take the time out to actually deal with it? If we found a gap in the law where cabinet can do it if a state of emergency has been declared. In this situation, a state of emergency was never declared, but the intent of the law was always to be that if an emergency or exceptional circumstances comes in, Cabinet at least would have had that level of authority. So on a state of emergency, Cabinet would have been able to do it, but without a state of emergency that wasn't declared, then the question is, thus the reason we asked both the Attorney General and the Office of the Auditor General to take a look at that to see what it is that we need to do to close that gray area within the legislation.
Thank you very much. Was the Attorney General view sought before the order was made or subsequent to? Or did he have a view about it in Cabinet? He usually does on these matters.
Well, seeing that it was a Cabinet paper and the Attorney General sitting in Cabinet, I would like to say that at least if there was an issue then, at least the Attorney General would say something. So the paper came to Cabinet, it was approved by Cabinet, and we believe if there was a situation where Cabinet didn't have the authority to do it, at least then the Attorney General would have said something. In that situation, paper came to Cabinet, it was approved by Cabinet, and as far as we're concerned, then if the Attorney General is sitting there, then it should have been fine.
Thank you, Mr. Chairman. Just one more question, I believe, and that is, was it known to you or to the Cabinet at the time that the order was placed to Crown agents that the Ministry of Education had already agreed to procure the same number of kits at a substantially lower price than the Crown agents' order?
Mr. Chairman.
No, the answer is no, but the difference wasn't substantial, to answer your question.
Mr. Chairman, I've been sitting here listening to this, and I was trying not to get involved in something that perhaps I should not say at this stage, but let me just say that the order from the Minister of Education that was brought, we landed it here for $2.51 CI, whereas Blue Waters was $2.55 CI landed. Do the math.
Mr. Chair, if I may ask your indulgence for my chief officer, who I would like to speak, who is very involved in the procurement part of this order that my colleague is referring to.
Mr. Chair, I am concerned about where the line of question has gone outside of this output budget. Now, there's three different elements here. There's your ministry, the Ministry of Education, the Ministry of Health. Now, if there's specifics to the Ministry of Health, that's where the line of question should be focused on. And then if the other member wants to speak about the elements in respect to your ministry or the Education Minister, ask the questions at that time. I think we've gone well outside of the rules and scope of the Ministry of Health in respect to this line of question, but I'm just saying, as per the rules that I am aware of, we've gone well past that.
Actually, I agree with you with that one, Minister of Tourism.
Mr. Chairman, I'm entirely in your hands, sir. I think you've done your endeavor best to answer the questions. The purpose of this is the pact, right? Purpose-driven, accountable, competent, and transparent. Trying to help you with the transparency a bit there.
Well, I will say this much, Mr. McLaughlin. I appreciate the assistance, but at the end of the day, we are only responsible for what we say. We're not responsible for what anyone else understands.
Mr. Chair, I would really seek your permission for my chief officer to clarify so that she can have an opportunity.
No, we're just going to move across our this issue now. This has already been ventilated, and the night is long. All those in favor of HEA 20, Public Health Programs, Investigation and Treatments, in the amount of $2,409,835 for 2022 and $2,409,835 for 2023. Please say aye.
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 Those against, no. The ayes have it. HEA 21 Medical Internship Program.
Mr. Chairman, I'm going to help us move along and say that you can take this down to HEA 26.
Thanks very much for that, Honorable Deputy Leader of Opposition. Colleagues, with the assistance of the Honorable Deputy Leader and his guidance of the opposition, we will take the next 1, 2, 3, 4, 5 items together. All those in favor of HEA 21 Medical Internship Program in the amount of $227,160 for 2022, $263,445 in 2023, HEA 23 Provision of Antiviral Medication, $492,000 in 2022, and $492,000 in 2023, HEA 24 Provision of Psychological Trauma Provision of Psychological Trauma Diagnosis and Treatment for Children in the amount of $105,000 for 2022 and $105,000 for 2023, and HEA 25 Management and Maintenance of Cancer Registry in the amount of $62,027 for 2022 and $62,027 for 2023, and HEA 26 Adolescent Medical Health Program, $840,000 in 2022 and $840,000 in 2023. Please say aye. Aye. All those against, no. The ayes have it. Colleagues, moving on to NDC 1.
Mr. Chairman,
Yeah.
you can do NDC 1, NGS 4, and NGS 53 together.
Thank you very much, Mr. Joseph Xavier. You. Colleagues, taking a vote now on NG's, all those in favor of NDC 1, Policy, Prevention, Surveillance, Research, Information, Monitoring, Evaluation, in the amount of $714,855 for 2022, $714,855 for 2023, NGS 4, HIV, AIDS, and First Aid Public Education Programs, $39,325 in 2022, and $39,325 in 2023. NGS 53, Palliative Care Nursing, $100,158 in 2022, and $100,158 in 2023. Please say aye. All those against, no. The ayes have it. Colleagues, next item, NGS 55, tertiary medical care at various local and overseas institutions, $20,926,911 in 2022, and $21,593,271 in 2023. Are there any questions?
Mr. Chairman. Through you, Mr. Chairman, to the Minister, this is the appropriation that covers the indigents and the seamen and veterans. And I can't help but notice that there's a reduction of just under $15 million from 2021 to 2022 and 2023. If the Minister could kindly indicate where those reductions are.
Honorable Minister for Health.
Mr. Chair, through you, can you say exactly, can I ask where he's seeing the reduction? Because I've actually seen an increase in what numbers I have before me.
Yeah, I'm looking at the plan and estimates, page 287. So maybe there's a mistake there again, or? No? Well, then there's a reduction of.
Similar to HEA 2, honorable member, the NGS 55 is a non-HSA care. And as in prior years, I think the current year budget for that amount was actually 16 million thereabouts, as opposed to the 35 million. So it's one of those where it is very difficult to directly gauge what the exact amount will be in terms of what would actually be used. But what we have done is actually increase the budget for this year compared to what it was, well, for next year compared to what it was for this year. So I think, again, this year you guys, this year the budget was 16 million, and you actually did 35 million, which is 19 million above. This is a situation now where you put a number in, but it's very hard to tell exactly where it is going to land.
And again, Mr. Chair, it has been increased for what we're proposing.
But the budget for this year was like 16 million and the 35 actual. So it's very, very difficult to budget for that one. Any other questions? If not, I'll take the vote. All those in favor of NGS 55, tertiary medical care at various local and overseas institutions, $20,926,911 in 2022, and $21,593,271 in 2023. All those in favor, please say aye.
Aye.
Against, no. The ayes have it. Colleagues, moving on to transfer payments now. TP 44, temporary poor relief payments for young parents program, YPP students, $70,000 in 2022 and $70,000 in 2023. Are there any questions? With that, I'll take the vote. All those in favor of TP 44, temporary poor relief payments for young parents program, YPP students, $70,000 in 2022, $70,000 in 2023, please say aye. Against, no. The ayes have it. Moving on to TP 73, other health and wellness program assistance, $500,000 in 2022 and $500,000 in 2023. Are there any questions? If not, I'll take the vote. All those in favor of TP 73, other health and wellness program assistance, $500,000 in 2022 and $500,000 in 2023, please say aye. Against, no. The ayes have it. Colleagues, moving on.
Mr. Chairman, you can do OE 15, OE 103, and OE 127 together.
Thank you very much, Honorable Deputy Leader of the Opposition. Colleagues, with the support of the opposition in this regard, I'll take the vote for the next three items. All those in favor of OE 15, Pan American Health Organization subscription, $15,000 in 2022 and $15,000 in 2023. OE 103, Caribbean Public Health Agency, CARPA, $18,500 in 2022, $18,500 in 2023. OE 127, Caribbean Association of Medical Council, CAMC, $10,500 in 2022, $1,500 in 2023. Please say aye. All those against, no. The ayes have it. Moving on to EI 153, Ministry of Health and Wellness. Sorry, EI 53, apologies. EI 53, Ministry of Health and Wellness, $7,875,000 in 2022 and $3,776,000 in 2023. Are there any questions?
Through you, Mr. Chairman, I just asked if the Honorable Minister could give us some indication on what are covered under this appropriation.
Honorable Minister for Health.
Mr. Chair, through you, under this appropriation, it covers the eGov initiative. That's a computer software. It includes the Department of Counseling Services as it pertains to 2022 for Health and Regulatory Service, $400,000 for the eGov initiative, and in 2023, $250,000 for the Nexus World Compliance Tool for 2022, $30,000, and for 2023, another $30,000, and for monitors and computers, 16 docking stations for 2022, $5,000 each for both years. And that's for the Department of Health and Regulatory Services. For the Department of Counseling Services, there's a broken down of a total for 2022, $410,000. That includes vehicle replacement, replacement of printers again, furniture, website file management, and the renovations of the new main office. And that goes into $50,000 appropriated for 2023, of $40,000 for the one vehicle and $10,000 for replacement of printers and computers. For MRCU, it includes an excavator, vehicles, that's a Toyota Hilux, one Ford, the Field Seeker software, ramp repairs, aerial application, drone, and stainless steel pump, allocated $859,000 for 2022, and a total of $274,000 for 2023, which covers the second vehicle. It's a total of 6 vehicles, and $35,000 for that in the next year of another Ford vehicle. That also includes some gates at the site of $15,000, and a stainless steel pump, which would be done in 2023. For the core admin, where the long-term mental health facility is concerned, this includes $5 million allocated for 2022. Major projects office of $50,000, also in 2022. 2 vehicles, $50,000 each, split over $50,000 in 2022, $50,000 in 2023. And office equipment, $75,000 allocated for both years, 22 and 23. We go then to Department of Health and Regulatory Services for solid waste, heavy. That's enough?
Thank you, Mr. Chair.
Okay.
You covered the mental health facility, and that's where
Yes.
I just wanted to make sure
That's-
that's, yeah.
Yes.
I probably should have been a bit more specific in
Oh.
my questioning, but that's the big ticket item there.
Okay, well, it is
Okay,
covered.
yeah,
Thank you.
Thank you very much, Honorable Deputy Leader Opposition. All those in favor of EI 53, Ministry of Health and Wellness, $7,875,000 in 2022, $3,776,000 in 2023, please say aye.
Aye.
Those against, no. The ayes have it. And finally, colleagues, EA 30, Cemetery Vaults, Grand Cayman, $173,700 in 2022, and $173,700 in 2023. Are there any questions? See no questions, I'll take the vote. All those in favor of EA 30, Cemetery Vaults, Grand Cayman, $173,700 for 2022, and $173,700 for 2023, please say aye.
Aye.
Against, no. The ayes have it. Call-
Mr. Chair, can I take this opportunity to extend my gratitude to all of the departments to fall within my ministry for their hard work and dedication in pulling this together. I thank you for working and having the patience as you have with me. It's my first time doing our budget. Congratulations to us, and to my colleagues, thank you for your support.
Thank you very much, Honorable Minister. Colleagues, that brings us to the end of Finance Committee for tonight. We will conclude tomorrow. We'll start back tomorrow at 9 a.m. sharp, and we'll be looking at the appropriations to the Premier, the Deputy Premier, the Deputy Governor, and the Attorney General. We'll try to get them for tomorrow. Ambitious, but we'll try. With that said, this committee stands adjourned for tonight, for tomorrow morning back at 9 o'clock.